Hello, I'm Dr. Bryan Haas. For many years now, I've specialized in spinal rejuvenation therapy and brain-based therapy. The spinal rejuvenation therapy is a state-of-the-art advanced therapy that we use in our office, and it was developed by Dr. Pettibon. This therapy utilizes non-surgical spinal decompression and has been proven clinically to correct severe chronic conditions, especially chronic lower back pain, neck pain, sciatica is a common condition patients come in with, spinal stenosis. Some patients that come in have been diagnosed with a disc herniation. It's also extremely effective with treating postural problems and scoliosis. Today I'd like to talk to you about back pain. You know, millions of people around the world, around our country, United States, suffer from chronic back pain, lower back pain especially. So it's crucial that we cover things from head to toe. Many times, or many patients that come into our office have acute back pain, meaning they've had strained their back from, let's say, a car accident or a fall. They had a whiplash injury, or maybe even a sports injury, which is pretty common in our office. Maybe they've lifted something wrong and kind of twisted in an awkward, funny way. Unfortunately, most and many of our patients that come in, they've suffered from chronic lower back pain. You know, maybe they've had it for 5 years. Some have for 10 years, 15 years, sometimes even their whole entire adult life. 30 plus years they've suffered from chronic lower back pain. That's unimaginable. You know, it's unimaginable, and in my opinion, it's a tragedy, and it breaks my heart to see these people suffer like this, because it's affected these people's lives. You know, it's affected their life. Their overall health and well-being has been affected. But you know what? We get these people better. Our patients that come in with these conditions, they do get better. In a few minutes, I'm going to tell you what the cause is and how we get these patients better. And it doesn't matter, folks. It doesn't matter if you've had a herniated disc. It doesn't matter if you've been diagnosed with facet syndrome, sciatica, spinal stenosis like we talked about, degenerative joint disease is another, maybe osteoarthritis. Some of you maybe even had what's called a spondylolisthesis, okay? Also, you may have been on a multitude or a laundry list of medications. Maybe you've even been to a physical therapy, done physical therapy, you've seen many doctors, and some of you have even had surgery, and in some cases, multiple surgeries without much relief. You see, the first thing is that I do all the necessary tests to determine what the cause of your lower back pain is. What's causing the back pain? And if it's a spinal problem or not. You know, sometimes it's not a spinal problem, and it could be affecting the nerves, it could be affecting the joints, the discs, spinal muscles might be involved, or maybe even the spinal cord itself, which we'll get into a little bit later. If there is a problem with any of these, our spinal rejuvenation therapy can definitely help you, okay? And in some cases of chronic lower back pain, there might be a result of decreasing cerebellum, which is the back part of your brain. It's this part of the brain right in through here that might not be working properly that can cause chronic lower back pain. See, this part right here, the cerebellum, it's responsible for your balance, your coordination, your fine motor and muscle movement. It also controls all of your postural muscles in your back there, along the spine. When the cerebellum is not firing the way it should, or it's not working the way it should, it causes the muscles to go into spasm along the spine. The muscles become really tight. They start to spasm. And as a result, that can cause the spine to lock up. It can lock up, it can kind of fuse, or it can just get locked or stuck in that area. And if that's happened, maybe that's happened to some of you. We've had your spine just kind of lock up into a condition like this, or a position like this. Your muscles are starting to just contract like that. It's very common to have patients come in like this all the time. So your muscles that are spasming there, and when they start to lock, they become frozen or stuck, we have to get the cerebellum working properly. We'll go over that in a few minutes and how we do that. See, this cerebellum that's not firing the way it should, we have several therapies that were introduced. Okay, when these spasms occur, there's a decreased motion in the spine, and as a result, the discs, which are in between the vertebrae here, we'll go over that here, the little spaces in between the bones here, those are the discs, they can start to bulge or herniate, and we're going to show that and discuss how that happens in a few minutes too. And when that happens, folks, that can cause severe lower back pain. And this is something we see very frequently in our office. See, the brain-based therapies that we do in our office to use to correct the problem with the cerebellum, the decreased firing of the cerebellum, is stop.